Suppose this is the line diagram of the heart, and this is the right atrium, and superior and inferior vena cava drain into the right atrium, while pulmonary veins drain into the left atrium. Now the blood from the atria go into the ventricle, and 70% of the ventricles get filled with blood during this rapid filling phase, and remaining 30% of the blood gets filled during atrial systole. So after the atrial systole, the ventricle goes into the contraction, and the ventricles are now filled with blood. So due to the pressure, the valves, mitral and tricuspid valve, will close, producing a sound known as S1. So S1 is due to mitral and tricuspid valve closure, and this is isovolumetric contraction because the volume is constant, it is not increasing or decreasing, and heart is now a closed chamber. Next, what happens is the pressure in the ventricles increase and it becomes more than 80 mmHg, because in the aorta pressure is 80 mmHg, and for these aortic and pulmonic valves to open, the pressure must exceed 80. So now the pressure is more than 80. The blood will gush out to the aorta, into the aorta and into the pulmonary artery, and which will result in opening of these valves, and the opening will make a sound known as ejection click. So ejection click is due to aortic and pulmonic valve opening, and this state is ventricular systole. After the blood has emptied out in the aorta and pulmonic valve, the pressure will fall drastically and these valves will close. The closure of these valves will make a sound known as S2. So S2 is due to closure of aortic and pulmonary valves. And after that, the heart is in isovolumetric relaxation state. And now again, the atria are getting filled with blood, and then the pressure of the blood will open these mitral and tricuspid valves, and the opening will make a sound known as opening snap. So the opening snap is due to opening of mitral and tricuspid valve. If we plot this on a line diagram, then we see that first there is S1, then after S1 we have ejection click. After ejection click we have S2, and after S2 we have opening snap. Then we have S3. S3 is seen in patients of congestive heart failure when there is ventricular turbulence, and S4 is when atria generates excessive pressure. So we have learned these four sounds, that is S1, ejection click, S2 and opening snap. These four sounds are high pitched sounds, and these are to be heard with the diaphragm of the steth, while S3 and S4 are low pitched sounds and are to be heard with the bell of stethoscope. Thank you.